So I was very honored when Senator Ted Kennedy, who's the chair of our committee, asked me to oversee and write the portion of our bill, the title of our bill, that deals with the workforce issues. You know, we can write and pass a healthcare reform bill that covers all Americans, but if we don't have an educated workforce, we will not have an accessible system. And that means a workforce of doctors and nurses and x-ray technicians and physical therapists and all the other healthcare professionals that provide the care that we need. To me, the workforce issues are just common sense, but they also make economic sense. Right now, we do have a shortage of healthcare professionals here in America, particularly in high-demand fields. Primary care is one that we have high demand and low workforce. General pediatrics, community health, general dentistry, nurses, as we talked about a few minutes ago. That lack of healthcare workforce puts a strain on qualified healthcare professionals across our system. And this shortage not only makes it hard to get care, access to care, but it makes it more expensive for everyone as well. So as all of us are focused today on getting our economy back on track and put people back to the work, one of the best ways we can do that is to help get people into healthcare professions. That's why the investments that we are writing into our healthcare reform possible are so important in healthcare reform. Let me give you a really good example. Today, too few of our medical students are going into high-demand general care fields. A lot of our students who are going through and becoming doctors are looking at more lucrative specialty fields. Why? So they can pay for the cost of their medical care. So I included in our title, in the bill that I wrote, incentives for loan repayment programs, scholarships, and grants to encourage our students to go into these high-need fields and to work in underserved areas, low-income, rural, minority areas where there is a lack of healthcare professionals. We also invest in allied healthcare workers. That's your EMTs and your x-ray technicians and your physical therapists. These people are all part of our healthcare system. They're not the doctors or nurses, but they are needed in order to provide quality care. And we invest in education and training and retention efforts, not just for new healthcare workers, but for those who are already in the field providing quality care today. I also created a National Advisory Commission of Healthcare Experts that will advise Congress about what healthcare education and training programs work best across the country and how we can use the federal dollars we have more effectively in the right places on workforce issues.